All right, Tracy.
Yeah, it's not over. It's not close to over. We are going to pay for it. People paying a lot, billions of dollars, and just trying to relieve back pain. Dan McKenzie is here. He's a rehab consultant with American Senior Communities. Jennifer Davis is here, specifically with Meadow Lakes Rehabilitation Services. She's the manager there. Thanks for being here. Appreciate that. You don't have to watch television for more than a couple minutes before you see a back pain relief sort of. Is this, I mean, is this a psychosomatic American condition, or are we really suffering from that much of it?
We are. I mean, you know, estimated 100 million Americans plus suffer from some sort of chronic pain, 80% of which is typically low back pain.
Okay.
It's a leading cause of disability in America. Economically, like you said, $100 billion plus is spent on managing chronic pain.
Is this because we're not stretching too active a lifestyle, or is it too sedentary a lifestyle, or is it a mixture of both?
Right, mixture of both. Just a big mixture of both. Women tend to have more lower back pain than men.
Okay, because they carry us. Right, that's on the, so, but some people just think, well, it happens. I'm of a certain age. I have a certain lifestyle, and I have to live with it. And like you said, it's chronic. So, what steps can be taken to some degree, alleviate it?
Yeah, in American Senior Communities, we always say exercise is vital. You know, keep moving.
Right.
Research tells us that
use it or lose it.
Absolutely, it's very true. Increased flexibility, stamina, strength, joint stability, core strength. All those things tend to reduce chronic pain. And we also employ a lot of different modalities in American Senior Communities. Physical aging modalities, ultrasound, cryotherapy, moist heat. The latest technology that we use is called the Dolphin Neurostim unit.
What?
It's actually a direct microcurrent stimulation. So we can actually choose trigger points in the skin that actually will relax or sedate tight, restricted, painful muscle groups and soft tissue.
All right.
And there's two things about this. It actually helps the body release endorphins, which are the natural painkillers.
Sure, right.
They can circulate for a day or two.
Right. So
it's prolonged pain relief.
Okay.
The other key piece of this can actually reduce cortisol levels. We know that cortisol is a major stress hormone.
Okay.
It's linked to cardiovascular disease and serious health issues. It actually drops 50% after one application, an hour afterwards.
50%?
Absolutely.
Oh my God.
And that's recent research.
Those are, I don't do math very well, but I know what 50% means. But some people might be watching and going, yeah, that's all great. You have these modalities and things, but I'm not a resident. That's not, I think people probably don't understand that doesn't have to be the case to benefit, right?
Correct. We have inpatient stay where we work with them in therapy, and as they progress and graduate, go back home, we have a continuum where they could continue to come outpatient. We have a wellness center that they can go to where it's Nautilus equipment. They have a routine they work out 3 days a week, and we can continue to service all their needs.
Are there some of the, like he mentioned, the modalities, I just like that word now, I never really used it before, modalities where you could, eventually it's something that could be done in the home when they've had enough visits?
They can come back for outpatient for that. There are certain modalities that they could do from home.
Okay, awesome. Is it a situation where you said chronic, where, like you said, the lifestyle, but is it sometimes, I've been told that the pain we're experiencing doesn't necessarily mean that's where a potential injury might be. That's where the body tends to supplement.
It can be a referred pain pattern a lot of times. It might be coming from the spine, and you feel things distally. Absolutely.
Okay, so what's the first step?
Well, we can actually do a demonstration if you want.
We got just enough time, maybe.
So Jen actually has a previous left hand injury, so we'll just kind of demonstrate. So we try to find a trigger or acupuncture point.
Okay.
When we get a high pitch,
really,
that's the treatment point for 30 seconds. And we can actually relax the soft tissue, decrease inflammation to get a prolonged pain release.
That's cool.
Yeah, and it doesn't, you don't feel anything. It doesn't hurt.
It's very gentle, very non-invasive.
You said 50%.
50% cortisol reduction.
And that's not with medications and having to...
Right. Well, no adverse effects.
No adverse effects.
That is very cool. We have the link to American Senior Communities on our website, indiestyle.tv. Thanks for the information.
Thank you so much.
That was great. Very enlightening. Amber, word of the day. Modality.
Modality. I know he said it.
I know. I am going to so annoy people all afternoon.
Hey, you know what that is? It's a modality. However you want to use it, you're going to find a way. I know, you can still talk. Coming up next, it is a trend on social media. Sweet potato toast. I love this idea. Michelle's going to show us how to make it when Indie Style comes up. Look at these.